great session. We'll have another one now. And you guys are all familiar with my magic wand, so I'll pass it around. And we're going to have the same question format, so we have some coherence and consistency. But first of all, let's welcome you, Anne, and from Canopy. Tell us a little bit about your moonshot and what's unique about your approach and how you're handling it, and tell us a bit about your company.
Sure. So Canopy is working at the intersection of women's health and mental health. Maternal mental health conditions are the #1 complication of pregnancy and childbirth, and 50% of them can be prevented. So Canopy is really looking to kind of intervene very early in the prenatal care process through our evidence-based, tech-enabled approach.
Well done. Nice and clean and crisp. Perfect. So Christian, welcome. Tell us a little bit about Medictor and what moonshot you're trying to reach.
Sure. So with Medictor, we are improving access to healthcare worldwide. And so we build up a virtual assistant based in artificial intelligence for triage and pre-diagnose. So basically what we do is assess symptoms online and drive patients to the right level of care. So instead of using Google, next time use Medictor.
Got it. That's, just real quick, now you're not from the United States, right?
No.
You're based out of
Barcelona,
Spain. Do you have the same regulatory requirements where you can't actually provide a diagnosis to patients?
Yeah, it's very similar.
Okay.
Very similar.
You have to stop just short of diagnostics.
Yeah, we don't substitute doctors in any way. Mm-hmm. We just guide them in the first decision where to go when first symptoms arise.
Excellent. Fady.
So thank you.
Pivotal.
For being here. It's Fady Barmada, and yes, it's F-A-D-Y. That's my real name.
I'm the Fady.
So I'm here with Pivotal. Our moonshot is access to care, and we firmly believe that everybody in the nation should have access to high quality, low cost care where and when they need it. So we looked at the main factors influencing access and categorized them into two, basically the hard factors, and those really describe the systems of care that exist in our country, and those are location, time, and cost, right? And time is a factor of productivity, physician productivity and capacity. And then the soft ones, which are really about people. They're about expectations, need, behaviors, all of the SDOH factors. And where the barriers actually come in is where those two are misaligned. And unfortunately, this is a massive problem, as we all know. There's gargantuan misalignment across the entire system. So what we do is we've built an analytics platform because that is operations and locations based. Our target is knowing that investments are catalytic, they're change agents within organizations to move us forward. We seek really to optimize each one of these investment strategies to help moving the needle, bridging that gap, and ultimately deploying equitable care across the United States.
So an AI platform to help us adjust the allocation resource to meet the right patient at the right time.
Right time, right care.
A cost-effective system.
That's exactly right. Right time, right care, right location, right cost. Absolutely.
Brian, Able. Exceptional concept. Tell us more about it.
Well, Able Channel is in the Hollywood pitch. It's Netflix meets healthcare. So 133 million Americans have a chronic condition or disability, and there is no defined media channel. So I saw that as a huge gap in the marketplace. Using streaming technology as a direct-to-consumer play, but then as we've evolved the business, started to work directly with providers so that they can have discrete channels themselves to access direct-to-patient. So integrated into their healthcare practice. So it's exciting. And also the other part of it that we have to recognize, and I say this because I think about it myself, we don't read as much as we used to. We watch a lot of video and we believe what we see. So we feel like there's a huge gap, especially amongst younger folks, to reach them earlier on because they're watching TikTok and whatnot. So the faster we can deploy credible content with partners where there's credible content, direct with the the premium providers, the earlier we can interdict, but also along the care path, once someone has a diagnosis, how do they get information? And if it's coming direct from the provider, it's a game changer in terms of their outcome. So,
yeah, one of the things that I love about what you're doing, or what you're doing represents, is that people from an industry outside of healthcare have seen an opportunity to bring your skill set to my world, because you come from the Hollywood, New York video space, right? And so you understand what you can do with that content and present it in a certain way. And actually saw an opportunity within healthcare and bringing those skill sets to us, which I think is phenomenal. Terrific. Thank you for doing that. Okay, so now I'm going to go to a question I like, maybe a 30, 45-second answer, okay? So I'm now a potential partner. You get to choose if I'm a clinical partner or a financial partner. What do you look in me? Oops, sorry about that. What do you look for?
So we primarily are looking for risk-bearing organizations. So integrated delivery networks, for example, who are interested in improving, especially maternal health outcomes, but also child health outcomes, and averting downstream costs, because maternal mental health conditions are actually the highest costing maternal morbidity. And obviously they're incredibly neglected. That's why we're working in this space. And we have the chance to, if we intervene early, decrease, you're 3 times more likely to have a preterm birth, for example, if you have an untreated mental health condition. But also preeclampsia, C-section, all of these kind of physical health conditions are inextricably linked with our mental health. So integrated, really
integrated network in which you can plug in and deliver your service to a set of patients.
Easy.
And Medictor, what's your ideal partner?
So, well, we have a proof value proposition for several players in the industry, health systems, payers, telemedicine platforms by itself. So Medictor makes sense before any telemedicine interaction. So we can fit, and we have done it, and we can prove our value with all these partners. So we are ready to be embedded seamlessly, white label, and provide value to our customers and to the patient.
Outstanding. So, Fadi.
Yeah, so I'm going to kind of move to the side. A little bit of column A, a little bit of column B.
Oh, column B, okay.
Right? The financial partners, right? Because obviously I do investment optimization, right? So we're investing in those care infrastructures and health resources. But I'm investing in health resources, so that has to be based in a deep understanding of the care model, its applicability and alignment with those needs of those individual populations. It has to be imbued with intelligence around best investment strategy for right resources, for right place and right time. It's not just about the physical space or even the individual physicians. It's about telehealth infrastructures, getting to the right locations, breaking the typical boundaries of where people would access care, improving those touch points. All of that needs to be imbued with a deep understanding of how care is deployed and how people access that care.
So if I was an investor, you'd be looking for someone with deep expertise in the space.
Absolutely.
You wouldn't want to quite jump into somebody who doesn't quite get it, because it's a complicated road. Awesome. Brian, investor or a partner?
Well, we're looking for strategic investors.
Terrific.
Providers and payers, because in the healthcare space, it's very different than in the direct-to-consumer side of things, which we have, because you have to prove efficacy, you have to have commercial contracts, and ultimately, that's where we need to be deploying so we can reach the greatest population with specific, information and care. So from our perspective, we're looking for investors that are strategic and also partners that want to integrate with what we're doing, because we feel as though it's a really effective solution.
So ideally a large healthcare system with an investment arm that can then deploy your technology within their like 20 hospitals, whatever it is.
Exactly, the innovations funds typically.
Perfect. All right, guys, magic wand time. As I said earlier, this is Hogwarts certified. So you get to wave it, and then it takes us to 2042, 20 years from now, and your technology is embedded into the health system. What's it look like? What has changed? Don't forget to wave it. It doesn't work otherwise.
Okay. So Every pregnant woman takes a prenatal vitamin to prevent neurological issues of the baby, or whatever, keep herself healthy and not anemic. Maternal mental health care would be a standard part of care, as common as taking a prenatal vitamin.
Outstanding. I like that vision.
First, it's work?
Yes.
Okay.
Yes, it works great.
So we see a day when everybody will find extremely normal to go through a symptom checking tool before accessing healthcare and finding it easy that way and safe. And this would be a worldwide trend, not a local thing.
Excellent.
Thank you.
Fadi.
So I see a world where women are taking a prenatal vitamin to reduce total need for care and to absolutely help them ensure that that they get all the support necessary. I see a world where, you're right, people are leveraging evidence-based medicine to get best protocol, best approach, all of that stuff in the right place at the right time. I see a world where people are accessing Able Channel, right, to get all of the information that they absolutely need at all times about all of the things that are afflicting their lives. That healthcare is ubiquitous. It is part of our daily lives, and because of that, right, our expectations are, we know how, where, when, and why to access care, and it's available to us at all times.
Outstanding.
We want to transform healthcare companies into a media company is really what it comes down to. Most of the folks that we work with are dealing with substandard content and limited distribution, and we want to apply that proven media and entertainment methodology on a multimodal system to engage with patients. And I'll just share this one thing that I think if we could do this and replicate this on a national scale 20 years from now, to your point, if people are using it, we did a program called Surviving Suicide. And we were told, don't do it, don't touch it, it's too dangerous a subject. We did it, NAMI tweeted it out, and we got inundated with people who said, this saved my life. So if we can do that, we could do that on a grander scale with other conditions as well.
Outstanding. Guys, I'm going to give you 1 minute each to answer one question. Leave the audience with a nugget of knowledge that you've gained in the past couple of years. If it's COVID-19 related, perhaps that might be a good trigger. So Anne, what was your biggest entrepreneurial lesson that you could share with us about starting out in the middle of a pandemic? Because you kind of started right in the middle of it, right?
We did. And in a way, that was an advantage for us because we had to design with the barriers already in front of us. And we were, our focus has really been on lower income moms, low income populations. And the barriers that they faced during the pandemic were, even more serious and severe, but there were also more opportunities to reach them in new ways. So we never had the luxury of having in-person anything. It all had to be virtual from the get-go. But it made a lot of kind of early design decisions. I think made us a better company because we had to think about the high barriers to actually getting people access to care. Even.
Yeah, absolutely. So, Benedicto, what challenge do you feel really speaks to your learnings in this past couple of years? Something that I didn't think of that before, but it's such an interesting knowledge point.
Well, maybe I always say that in healthcare, obvious things takes a long time to happen. But I think that COVID has changed somehow this and accelerated the adoption of technology by all corporations, all members of the ecosystem. So I saw this shift and this acceleration, so just hoping that we keep the pace.
Right. Huge acceleration through the adoption, through accessing this technology. So at Pivotal, did you see a shift that drove maybe some knowledge, impart some new wisdom to us of what you learned in the process?
Well, new. I think I'm going to reinforce, this was for us, kind of your point, right? For us, you know, I have a strategic decision modeling platform, right, an optimization framework. When COVID hit, strategy kind of went out the door because everybody was really, really focused on the here and now. They had to care for patients, right? So we, had to pivot. I had to throw that pun in. Come on,
Yeah,
sorry.
better.
We had to really figure out how to leverage what we do to best help our partners be able to shift their capacities and focus on what was absolutely necessary and in front of them. And then that forced us to take a whole lot more holistic perspective on the decision influences and ramifications at each scale within an organization. So it was a really interesting time. We learned a lot from it, and I think because we were able to be so flexible and adaptive, we have a much higher value solution.
Yeah. So both of you responsive to the moment, being able to change your thought process and to match the needs of your audience, which has shifted, the ability to access accounts that perhaps weren't available to you before, but also being ready to do so. You have to scale quickly. And then also, I really loved your story about going against the grain, going with your vision, making the content you think has an audience, realizing the audience's content, and then building on that. So to all of you guys, actually, did I give you time to answer? No, I didn't give you time to answer. I gave
No,
you.
but I have the one.
You had them on, and you have a minute, so go for it. I apologize.
So when COVID hit, we were launching our direct-to-consumer version of the channel. Production got shut down. So what I realized very quickly was that we needed partners at the provider and payer level to have discrete channels. So that actually informed our, not a pivot, but an extension of what our vision was, to go direct to patient through these partnerships, which I think in the end, especially as it relates to digital health financing, was a smart move. And you know, it really effectuated a change in our plans, but at the same time, made it more valuable. So
actually, it sounds across the board, some of these are all silver linings in many ways.
yeah, because you know, no one would have believed that telehealth would have exploded as vastly as it did. So this was a next logical step in that process, right, for us, for patients to access content.
Ladies and gentlemen, Canopy Health, Medictor, Pivotal, and Able channel. Come visit us at the Startup Health booth downstairs and talk more about these ideas with them later. I want to thank you all for participating and sharing your knowledge with us.